CPAP can be intimidating not only for the patient, but also for the provider. So let's talk about some best practices. First off, remember that CPAP is a great resource, great tool to use on patients that are exhibiting moderate to severe respiratory distress. These are patients that are using a lot of accessory muscles, maybe one or two word sentences, and are actively working to breathe. The whole point of CPAP is to help reduce the workload on that patient so that way they don't have to work so hard to breathe. So what are some best practices to ensure that you're successful when putting CPAP on a patient? First off, remember, because this is probably a pretty high acuity patient, you may need to divide and conquer. That means one provider is going to be listening to lung sounds, one provider is going to be taking a palpated blood pressure, ensuring that it's above 90 systolic, and one provider is going to be setting up the CPAP and selling this product to the patient. So why does CPAP sometimes not work on some patients? Well, sometimes patients are extremely anxious when they're having a hard time breathing. And it's going to be up to you as a provider to sell this product to them and ensure them that this is going to be in the best interest of them. It can be a little bit scary at times for them because it is loud and it can feel like they're working against the device. But once they relax a little bit, it should work pretty well for them. Another reason why CPAP may not work for some patients is because the pressure may be set too high or too low. So remember that first off, when you set this up, remember to hook it up to oxygen prior to putting it on the patient's face. We're looking at a start at 8 liters per minute on the regulator. And then once we put this up to the patient's face, we're looking for a manometer reading around 5. Now, this isn't a set it and forget it. Once you put this on the patient, you may need to adjust the pressure for the patient's comfort, but also for the patient's presentation. If you put this on to the patient at too high of pressure, you run the risk of not only scaring them, but also really blowing a lot of pressure into their face, and then ultimately they're going to decompensate. If you put this pressure too low, then they're going to feel like they're suffocating, and again, they're going to decompensate. Remember that once you put the CPAP on, you're going to need to take vitals every 5 to 10 minutes to ensure that the patient still is maintaining a good enough blood pressure and that they are not decompensating. Another thing to note is when you put the CPAP on, you want to make sure that this little dial here is set at CPAP mode and not nebulizer mode. So once you put this on and you've decided that the patient's going to maintain this on for a period of time, then we can go ahead and put a nebulizer or albuterol into the nebulizer, and then we can switch this over to the nebulizer mode. What that does is that changes the pressure and it diverts some of that oxygen instead of coming through the CPAP over through the nebulizer. Keep in mind, though, that when you do that, you're going to have to increase the liter flow on the regulator to maintain the proper pressure on the manometer. Conversely, when you're done with the nebulizer and you decide to turn this off, remember to decrease the pressure on the nebulizer so that way you can maintain that pressure. Hopefully these tips help for you.